You don't need to eat in secret anymore. I know you feel guilty, but it's not your fault. Binge eating disorder is a serious medical condition caused by complex genetic, environmental, and psychosocial factors. My name is Dr. Rachel Goldstein, and I'm an adolescent medicine doctor at Stanford University. I specialize in taking care of teens and young adults. I've treated many patients who've struggled with eating disorders. In this video, I'll be discussing binge eating disorder and what to do if you think you might be suffering from this condition. Binge eating disorder is actually more common than anorexia or bulimia and can be associated with many psychiatric disorders. Unlike anorexia or bulimia, though, binge eating disorder doesn't involve the behaviors to limit weight gain, like purging or excessive exercise. But, like anorexia and bulimia, binge eating disorder is a disease where people may feel like they've lost control over their eating. During these binge episodes, people may continue eating despite feeling uncomfortably full, eat large amounts of food even when they're not hungry, or eat more quickly than normal. If you've found yourself feeling guilty or eating in secret because you can't control your eating, I want to tell you that it's not your fault. Binge eating disorder is a mental health condition that needs treatment. But the first step in treatment is acknowledging that you're struggling with your eating and deserve to get well. A major barrier I hear from parents and patients alike is that youth feel like they'll be judged or shamed by their parents or close friends if they reveal what they've been going through. These can be really difficult conversations to have, but I've found that time and again, if you describe how you're feeling, how you can't control it, how you want it to stop, chances are you'll be met with compassion and not judgment. Now, that doesn't mean that some conversations don't go as planned. In those situations, it can be helpful to talk to another trusted adult, like a teacher, coach, or neighbor, because the goal is to get help. Now you've confided in a trusted adult and you've scheduled an appointment. You're probably wondering, what's going to happen at this appointment? Ideally, you'll be meeting with someone like me, a trained physician in eating disorders. If you're having trouble finding appropriate providers in your area, see the description of the video below for more resources. For example, during a visit with me in clinic, we'll check your height and weight and may order some basic blood work like cholesterol or glucose to make sure there isn't anything else we can treat like diabetes, high blood pressure, or high cholesterol. But mostly, we'll talk. I'll want to know about your eating habits and binging episodes. How often do they happen? When do they happen? What do you feel like before and after the episodes? Are there any triggers? I'll also want to know about your mood. Have you been feeling sad or anxious? Really, I want to get to know you as best as I can so we can come up with a treatment plan that meets your needs. Based on our discussion, we'll come up with a treatment plan. While there are many options for treatment, the goals of each are the same. We want to reduce binge eating episodes and address any other problems that may be contributing to binge eating, like anxiety or depression. The primary treatment for binge eating disorder is psychotherapy. Unfortunately, there's still a real stigma around therapy for eating disorders. Folks often have lots of preconceived ideas and misconceptions about what therapy is. Ultimately, it's about working with a trained mental health provider to develop a healthier relationship with your body and with food. The relationship with a therapist is a working relationship and can sometimes involve trial and error, and that's okay. Ultimately, you need to find out what works for you, and what works for one person may not work for someone else. What we know is that psychotherapy has been shown consistently in studies to be our best treatment for binge eating disorder, with over 50% recovery rate. I know it seems like a long road to get help, but right now know that it's not your fault. The first step in this journey is being compassionate to yourself and knowing that you're worth the effort.